Are you a patient watching this right now? I'm going to give you three best tips to keep you away from us. Keeping you away from us would help you save your money in your pocket. So that is one key reason you should take this tip. Watch to the end. Alright. Welcome to the channel. My name is Dr. Achievement. I'm a degree holder of physiotherapy and a master's holder to be of sports therapy. Alright, so these are my three tips. Number one, you should try to remember patients whenever you do anything that is too hurtful or you do something that is too less. Like, our body is in a way like too much of everything we used to say is good, is bad, and not having some things is still bad. Not having some limits is still bad. What I'm trying to say is, like, for example, apply this technique in your work. Like, now I'm sitting making this video talking to you, my patient. I'm talking to you. So if I sit here for a very long period of time, it will be too much to myself and it's bad. Why? I will be having back pain. Or if I am working and I'm having anxiety and did not try to cool myself down, it's bad for me. Why? I'll be having nervousness, I'll be having tension, I'll be stressed out, and all these things will play a directional pathway coming to the organs and affecting productivity and etc. And it's not good, right? So that is why it's bad. But what if I'm not pushing myself? Like, I made a video recently talking about my motivation, which pushed me, and my grades are awesome this time around. So if I'm not pushing myself, then my grade will be bad. So what I'm trying to say in essence, patience, whenever you're sitting doing your job, try to take some rest in between and try to still push yourself to do your job so that you get money and you do whatever you want to do, buy the clothes for your kids and etc. But remember, take some rest. All right, whenever you're tired, whenever you're fatigued, try to take some rest. All right, now coming to my next point. This next point is very underlooked, nobody cares about it, and that is dieting. Why must you eat something that is harmful to yourself? Most patients, they don't care. I was having a food one time and I immediately I ate the something. Like, we went out as a group of friends. Okay, they bought the food. They say it's kind of Indian style of eating, called bature. Immediately I beat the food. Goodness, I hate this. Why do I hate it? Because it was too oily, and too oily, you know what it means, guys. Like, don't joke with that kind of bad oil put into your heart and your lungs, your cardiac issue. Even I'm very fit, I go to the gym, I work out nicely, I'm strong, but I still hate whenever I taste too much oily stuff. I don't like it. I just, no, not for me. Too much sugary stuff, no, not for me. So you should try to control your diet. And most of those people that like drinking, remember, you can have fun, but too much of it is bad. And most of our patients who like smoking cigarettes, I don't know, it was yesterday when I was reading one article, I now know the benefit of marijuana. But marijuana has some benefits. It can cure cancer. Nobody knows, but too much of it is bad because it has some issues, like it crosses the blood-brain barrier, it stimulates this and that in the body, and it causes that and that, blah blah blah. Right? So we should always put that point in our head and remember that. Coming to the last one, which I got so pissed with one of my patients one time. I was like, you know what? Don't call me anymore. And that is exercise. Like, seriously? You don't want to do exercise, you want to get better, and exercise has many benefits. I'm I'm telling you the truth. Exercise has a lot of benefits. And I hate it when patients are stubborn of doing exercise. I really hate it. Like, exercise, in fact, remove medicines. I know medicines is very essential sometimes in some cases, like they stimulate and block some stuff which is very needed and helpful. But remove exercise from the topic. Remove medicine from the topic. With exercise, you don't need medicine. Exercise will promote fast healing. What do you need medicine for? Like I was talking about anabolic steroid, or I was talking about NSAIDs. What do you need them for? If exercise can promote fast healing, exercise can promote fast repair, strong bones. Exercise can promote what is it called, capillarization and etc. Good adaptation of the heart, the lungs. You don't need any medicine for that special. Even medicine, what does medicine do? There's no medicine that can make your heart strong. No medicine till now. It's only exercise that can do that. Medicine can just only repair or block some signals which is causing the damage to your heart. That is what they do. Quote me anywhere. Medicine can only, like, let's say you're having obstruction to your lungs, you're having some issues with your lungs, medicine can help you block some pain signals to your brain. Very funny, right? You're having pain, you're walking and you had a fracture of your bone. All right, exercise cannot work at initial, except the pain is released. Come to us with physiotherapy. In fact, you're coming to us as a physiotherapy, or you're having a fracture. Let's say surgery, we are giving surgery that, okay, surgery will give you ORIF, which is open reduction internal fixation, all right, just to put the bone together so that the healing will be aligned. All right, they will now stitch it and some other stuff which they will do. Fine, I give them that. But after the healing has repaired, like let's say 2 weeks to a month, you come to us to the hospital. What are we starting with? We're starting with to check how strong your muscle is, how strong the bone is. Now we are referring back to two things basically. First is nutrition. Second is what? Second is exercise. Patient having issues with their nerves, like let's say facial palsy, when they come to me, first thing I'm starting with is to check how the movement is, how much contraction they can make. Like from some people who have Behr palsy, facial palsy, these muscles will just be normal. Like if I'm having some issues with one part of my face, God forbid, not me. All right, now this side is now normal, it's now straight. Now this side is the one making the contraction. You can see how it's moving. So what am I going to start with here? The treatment, the number one treatment, guys: exercise. What will medicine do? Medicine will just come to your brain and stimulate the secretion of this, secretion of that, just to promote the fibers which will be acting on nerves. And the fibers which, whatever they are secreting, is coming to act on every part of the body, not just here. But though it will help if there is more secretion towards this point. All right. But what are we starting with? Is exercise, guys. So I don't know why many people don't tend to do exercise. If you can't do exercise because of you have to go to your work and you'll be late, then you can do exercise at the evening time when you return. You just exercise. You can make it very simple. I'll be making a video on how you can make your exercise very simple. Click and watch. Thank you.